With less than half of the US population vaccinated and the Delta variant causing record deaths in India, the CDC listed on their website some of the things that they were still learning about how well the vaccines protected us.
Today, CDC is updating our guidance for fully vaccinated people. Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic. We have all longed for this moment when we can get back to some sense of normalcy.
As India's streets empty because of localized lockdowns, burial grounds and crematoriums continue to work day and night. And in India's poorest states, Uttar Pradesh and Bihar, 100 bodies of suspected COVID-19 victims have been found floating in the Ganges River.
Our officials are at the scene and investigating. We are trying to find out where did these dead bodies come from, how did they get here, and their numbers.
With crematoriums around the country struggling to deal with a huge increase in bodies, residents of Ghazipur in Uttar Pradesh say they informed the local administration about a shortage of wood for cremation.
Just a few hours ago, the Center for Disease Control and Prevention and the CDC announced that they are no longer recommending that fully vaccinated people need wear masks. This recommendation holds true whether you are inside or outside. I think it's a great milestone, a great day.
Meanwhile, in Brazil, nearly about 4,195 Brazilians are said to have lost their lives due to the COVID-19 infection in the last 24 hours. And this is the highest single-day death toll that has been reported from Brazil. And the surge has come as the more contagious variant of COVID-19 infection is wreaking havoc across the South American nation.
Let's just rewind a little bit. Why does it seem like the US and the rest of the wealthy nations of the world's strategy for dealing with COVID-19, a global pandemic, seem to be mainly made up of vaccinating themselves?
In one part of the world, a race to vaccinate. In another, the long wait. Richer countries have plenty of funding and plentiful vaccine doses. Poorer countries have neither. It could be years before some are fully vaccinated.
A month ago, we heard the head of the World Health Organization. Months ago, indeed, we heard the head of the World Health Organization warning us of the dangers of catastrophic moral failure. We know from Oxfam that nations with 14% of the world's population had 53% of the vaccines, but the distribution of vaccines is not the really crucial issue. The really crucial issue here really is the fact that there is a limitation on supply. And that limitation on supply is not natural, it is a choice. It is a choice to limit the manufacture and supply of COVID-19 vaccines to ensure and to protect profits. It is an artificial scarcity and it is a choice. And that choice is having a consequence. Because around the world, we have seen now, deaths are escalating. In India, there were 2,000 deaths yesterday. In Brazil, there were 2,000 deaths yesterday. In India, by the way, with those 2,000 deaths, just 1% of the population have been vaccinated.
In terms of that, there's been some speculation that the changing intellectual property rules and allowing these vaccines, as you say, the recipe for these vaccines to be shared would be helpful. Do you think that would be helpful?
No.
Why not?
Well, there's only so many vaccine factories in the world, and people are very serious about the safety of vaccines. And so moving something that had never been done, moving a vaccine from, say, a J&J factory into a factory in India, that it's novel. It's only because of our grants and our expertise that can happen at all. The thing that's holding things back in this case is not intellectual property. There's not like some idle vaccine factory with regulatory approval that makes magically safe vaccines.
Regarding the moral duty that we all have to vaccinate humanity, to end the pandemic, I want to share with you two numbers. $9,000 billion. $9,000 billion, $9 trillion. This is the sum of money that the G7, the leading economies, central banks, printed to give to the bankers during the pandemic between March of 2020 and today. $9,000 billion. Now for the second number. The International Monetary Fund has come up with an estimate of how much it would cost under present prices to vaccinate the world using existing vaccines, to vaccinate everyone fully, 2 doses when necessary. 39 billion. So compare and contrast. 9,000, 39. They printed 9,000 for the bankers, and they are still thinking about how to vaccinate the world that would cost only 39. We progressives, of course, never expect the central bankers of the capitalist West to produce the 39 billion, even though it would just be a touch of a button for them, to vaccinate humanity. We do not expect such humanism from them. But comrades, it is essential that we broadcast from the rooftops the news for everyone to listen to, that they printed 9,000 billion and only with 39 they could have ended the pandemic for the world.
Now back to our initial conversation about the CDC and their incredibly reckless and probably politically motivated decision to tell vaccinated people it was okay to remove your mask.
The latest COVID-19 variant has the World Health Organization urging people to wear a mask even if you're fully vaccinated. So far, the CDC has not changed its position from a month ago, saying vaccinated people do not have to wear a mask.
By July the 4th, there's a good chance you, your families and friends will be able to get together in your backyard or in your neighborhood and have a cookout or a barbecue and celebrate Independence Day.
I cannot say that we have met all our 4 tests for proceeding with step 4 on June the 21st. I think it is sensible to wait just a little longer.
Let's go back to the start. In October, a new variant was detected in India. 6 months on, in April, India's cases were surging, and several mutations of the variant were causing concern. One was called B.1.617.2. This was Delta, and it was gaining international attention. The World Health Organization designated it a variant of interest on the 4th of April.
After wreaking havoc in India, the Delta variant of COVID is now present in more than 85 countries across the world. And the worry does not seem to be over yet. Israel's Ministry of Health has stated that it has observed a decrease in vaccines' efficacy to 64%. Israel primarily uses the Pfizer-BioNTech vaccine. The Ministry of Health of Israel has also noted that there is a decrease in disease prevention with symptoms to 64% as of June 6. The decline was observed with the spread of Delta variant in Israel.
Forecast that we could largely be back to normal by June 15th.
You know, I've never been as optimistic and as hopeful in this past year as I am right now, Conan. So I would say, while I'm still vigilant, I do think things are different. I think that we probably had variants that burned through us in December and January, which is why we had so many cases here. I also know that now we have about 50% of our population that already have had 1 jab, if not 2.
We're going to give 5 custom hunting rifles and 5 custom hunting shotguns away on Father's Day. To be eligible, you have got to get your first shot.
Once you get vaccinated, you're not going to have to wear masks. You're really not, required to do certain things if you're in contact with somebody who's had a virus. You are healthy. You probably will be healthy.
Now, concerns are growing in Israel after some fully vaccinated adults got infected with the coronavirus. The country had one of the fastest vaccination programs in the world, but now cases there are rising again, fueled by the Delta variant, and officials are reimposing some restrictions.
The World Health Organization is warning countries against dropping public health measures like social distancing and masking as the highly infectious Delta coronavirus variant continues to spread worldwide.
This is a simple, basic proposition. If you're vaccinated, you're not going to be hospitalized, you're not going to be in an ICU unit, and you're not going to die.
Are you aware of any fully vaccinated individual who has died of COVID-19?
We do keep a track of this on our website. We are asking hospitals and healthcare facilities to send us cases of what we're calling breakthrough infections. They occur, they are rare. We are aware of 223 as of May 10th that are among the 115 million people that had been vaccinated by that time. I also want to convey that now many hospitals are screening people for COVID when they come in. So not all of those 223 cases who had COVID actually died of COVID. They may have had mild disease but died, for example, of a heart attack.
So you said 223 cases, but no confirmed deaths of people who are vaccinated from COVID.
I'm sorry, there have been 223 deaths out of 115 million people who have been vaccinated. An extraordinarily low rate when you consider the death rate of COVID itself.
Take a look at the numbers. According to the most recent numbers from the State Department of Public Health, there have been more than 5,100 breakthrough cases here. A few hundred people ended up in the hospital. 80 people who were fully vaccinated in Massachusetts died of COVID because they got a breakthrough case.
I'm told you have some breaking news. What's that about?
That's right, Alex. You know those Texas Democrats who have fled the state and are now in Washington amid this fight over voting rights? We are now told that 3 of them have tested positive for COVID-19. The first one tested positive last night, and then after that, the rest of the Democrats were given tests. This morning, 2 more of them testing positive, according to Texas Democrats. All of them had been vaccinated for COVID. So these are breakthrough cases. Just the latest reminder that while getting the COVID vaccine dramatically reduces your chances of getting seriously ill or dying from COVID, it does not mean that you cannot actually still contract.
And finally, the long-awaited reversal.
Exactly what problem does the Delta variant create that masks for vaccinated people solves?
Good morning, John. Thanks for having me back. We have new data here. We have always seen, first of all, I want to re-emphasize our vaccines are working just as we thought they would with the Delta variant to prevent severe hospitalization and death. We should be getting vaccinated to prevent severe disease in ourselves and to protect ourselves from the Delta variant and from getting severe COVID. Here's the new science that we saw just in the last several days. With prior variants, when people had these rare breakthrough infections, we didn't see the capacity of them to spread the virus to others. But with the Delta variant, we now see in our outbreak investigations that have been occurring over the last couple of weeks, in those outbreak investigations, we have been seeing that if you happen to have one of those breakthrough infections, that you can actually now pass it to somebody else. We thought that was really important for people to know and understand, because when people are out there vaccinated thinking that even if they get mild illness, they can't give it to someone else, if they're then going to a loved one who's immunocompromised, who isn't yet vaccinated or couldn't yet be vaccinated, we wanted them to take the protection to protect others.
To protect others, exactly. Why didn't they say that from the beginning? Just wear a mask to protect others. I shudder to think how many people were hospitalized, died, or spread the virus because of this reckless policy. The CDC was fully aware the Delta variant was probably on its way and probably going to mutate. The director of the CDC is an appointee of the President of the United States. By telling vaccinated people they could take off their masks was a psychological symbol that declared a global pandemic over in the minds of most U.S. citizens. It's heartbreaking to contemplate the damage this wrong-headed policy caused. And the only rationale I can come up with for it is that they wanted a political victory. But the United States doesn't operate or live in a vacuum. Just like the climate crisis, the solution is global. The solution must be global, or it won't work.
So what's the data? We've learned clearly now, without a doubt, that people who are vaccinated get a breakthrough infection, actually have enough virus in their nasopharynx that they can actually transmit it to other people and have documented transmitted to other people. So because of that, the virus has really changed, and that has really triggered the change in the CDC guidelines. So right now, the way you correctly said, that even if you are vaccinated, you need to wear a mask.